Hello everyone, I'm Dr. Adam Maulana. How are you all doing today? I hope you and your loved ones are healthy and doing well. Today, I would like to introduce you to a part of the body located close to the ear that many people may not be familiar with. It is called the mastoid cavity. Friends, gently feel the area of the bone located just behind your ear. This area is part of a bone called the temporal bone. Inside it are small air-filled spaces known as mastoid air cells. Together, this area is commonly referred to as the mastoid system or mastoid cavity. So, what does this part of the body actually do? The mastoid cavity is connected to the middle ear through a system of air spaces. This structure is part of the ear's ventilation system and contributes to maintaining the environment around the middle ear. Although we cannot see it from the outside, this structure is located close to important parts of the hearing system. That is why maintaining overall ear health is important. One thing we should understand is that certain middle ear problems, particularly infections that are not properly managed, can sometimes involve the mastoid area. Inflammation of the mastoid bone is known as mastoiditis. However, there is no need to immediately worry every time you experience ear discomfort. Not every ear complaint means there is a problem with the mastoid. Many ear conditions have different causes, and an examination is needed to determine what is actually happening. The important thing is to recognize unusual signs. For example, you may experience pain or swelling behind the ear, redness in that area, fever, ear discomfort, or fluid coming from the ear. In some situations, the outer ear may also appear to be pushed slightly forward. If symptoms like these occur, especially after experiencing an ear problem, do not simply ignore them. It is best to consult a doctor, particularly an ENT specialist, so that your ear can be properly examined. Friends, one common mistake is trying to manage ear problems based only on assumptions. The ear has a fairly complex structure, and similar symptoms can have different causes. For this reason, avoid putting objects into your ear unnecessarily, and do not use ear medication without knowing whether it is appropriate for the condition you are experiencing. Taking care of your ears also means paying attention to your everyday habits. Keep your ears clean in a safe way, avoid excessive exposure to loud sounds, and pay attention if you experience persistent changes in hearing or unusual ear symptoms. Friends, learning about our anatomy is not simply about gaining knowledge. Understanding how our body works can help us become more aware of changes that may occur. The mastoid cavity may not be visible from the outside, but it is part of an important system connected to the middle ear. Therefore, when ear symptoms persist or are accompanied by unusual signs, do not delay seeking a proper medical evaluation. Once again, I'm Dr. Adam Maulana, and I want to remind you not to wait until ear discomfort begins interfering with your daily activities before you start paying attention to your ear health. Recognizing symptoms early and getting the right evaluation are wise steps toward maintaining our health. The moral message is this: our bodies often give us signals before a problem becomes more serious. Do not ignore those signals. Recognize them, protect yourself, and take care of your ear health wisely, because the ability to hear is one of the gifts that allows us to stay connected with the people and the world around us. I hope this information is helpful. Stay healthy, take care of your loved ones, and I'll see you in the next discussion.